Hi, I'm Dr. Gary Motykie, and I'm a Beverly Hills board-certified plastic surgeon. And today we're going to talk a little bit about a couple different things, but silicone injections in the face in particular, and also Priscilla Presley. The reason we're talking about both of these things is, one, to try to educate you about not injecting silicone into your face, and then two, Priscilla's just been in the limelight recently because of the new Elvis movie that came out about his life. And so there's some photos that popped up more recent of her, and she's also admitted that she's had silicone injected into her face, and she's been dealing with it for many, many years. So we're just going to talk a little bit about how that might have happened and how to prevent yourself from getting those things injected into your face. We're not picking on Priscilla Presley, but her spokesperson actually said that sometime in her past she had industrial low-grade silicone injected into her face. And that's not a good thing. It's like the same thing that people use for greasing car parts and different sorts of things, and it's not something you really want to inject into your face. Having said that, back then, a long time ago, artificial fillers or dermal fillers, hyaluronic acid fillers, all these sort of things didn't exist. So people were trying to inject things in their face to make it fuller, more youthful, and back then, some people were injecting silicone. I think sometime after that, there was collagen injections, things like that. And then more recently, like I said, we have the hyaluronic acid fillers. But back then, that's all they had. And there was a doctor named Dr. Daniel Serrano, who was well known in the Hollywood circles to be injecting the silicone into celebrity faces at their houses. And eventually, actually, he finally got caught. He wasn't an actual licensed physician in the United States. He was from Argentina. He actually served prison time and was deported back to Argentina after serving 18 months. But in the meantime, he did a lot of damage to a lot of celebrity faces. So from the court records, we know that some of the celebrities were on record for having the silicone injected into their faces. We know about Priscilla Presley. Was also in the court records, Larry King's wife and Lionel Richie's wife also had injections into their face at their houses or at their homes. They would have Dr. Serrano come over, they'd pay him cash, and he'd inject their faces with silicone. Usually the records say that he was charging somewhere between several $100s to several $1,000s to have the silicone injected. Again, this is low-grade industrial silicone into their faces. And then a lot of these women started complaining. As we know, time goes on with silicone injections, they start to form scar tissue, lumps, bumps, hardening in the face, such as their lips, getting lumps in their lips, not being able to drink liquids in their lips, lumps in their faces. So all of these things started to pop up, and that's when they started to go after Dr. Serrano. According to the authorities in the case, Dr. Serrano would give out business cards saying that he was a doctor, even though he wasn't a doctor in the United States. And then he would also go around to local cosmetologists, estheticians, different providers in the community, and tell them, if you refer patients to me, I'll give you a referral fee. And there's some of that still goes on even today for different sorts of things. I don't think it's a great idea that somebody's being referred for money. They should be going to somebody because of their reputation and their skill, and not necessarily because they're getting a referral fee. And then he would go to their homes and inject them at cocktail parties, different events. And I think the thing about that, again, is these people had no idea who this person was. He's also kind of a fraud. He wasn't really a doctor in the United States. And then he was injecting illegal, low-grade silicone into their faces and charging them cash. So a lot of those things, again, are warning signs. Be careful. You don't necessarily want to have a doctor come to your house if you don't know who they are, don't know their education, don't know what they're injecting in your face. All of these things are warning signs, big red flags that maybe you shouldn't be doing this and having something injected in their face that you have no idea what it is. So again, I have to say, what was Dr. Serrano's motivation? Do you think he really wanted to create beautiful results and really cared about not causing harm and wanted to help these patients to look better? Or was he more interested in the money? And the court documents say that as the silicone flew out of his syringes, the cash poured into his pockets. And they said something like they found more than $1 million in cash in his safe deposit box at the bank. And then they also said that he didn't use any sort of sterile technique. He would use ungloved hands to inject the silicone. The bottles weren't alcohol swabbed. All these sort of things, again, are just awful warning signs. And I think that if you're ever in that situation, get out. And then secondly, one of the worst parts about this wasn't even the immediate effects. There could have been infections, there could have been other problems, but it's the long-term effects of what he was doing. So like I said, a lot of these patients came back with lumps and hard rocks in their face, holes in their face. And then worst of all, it's very hard to get the silicone out of the face once it's injected, because it was a liquid silicone. So when they inject it into the face, it incorporates into the tissue, forms scar tissue. And that makes it very difficult to remove because particularly in the face, there's very important structures, nerves, blood vessels, other things in the face. So a lot of these women that got injected were stuck with it permanently for the rest of their lives. Again, I think even Priscilla Presley, when we started talking about her, she to this day still has silicone in her face, most likely, because as I said, you can't remove it. So a lot of these women are still walking around today with silicone still in their face. One exception would be the lips. I know that there's women, and I've removed it personally, from people's lips where they had it injected a long time ago because there isn't as important kind of nerves and structures in the lips. So you can sort of remove it from the lips. I still don't advise injecting into the lips. And if you can remove it, then you can sort of replace it again with maybe the patient's own fat or hyaluronic acid fillers. But again, it can still lead to scarring, lumps, and bumps. So again, don't inject silicone into your face or into your lips or actually anywhere in your body. I would say some things to take away from this is I always tell people never inject anything permanent into your face for many different reasons. First of all, like we said right away, it can become infected. Other things can happen. It can turn into lumps. It can form scar tissue. And then also importantly, the face is going to change, right? So as we age, face is going to move and change. So if you put something permanent, it's going to move around as you're aging and changing, and it may not end up where you wanted it to be 10 years ago. And then, like I said, very difficult to remove it. So once it's in that face, the other thing I want to say is as we age, not only does it move, but the skin, the fat, your face will thin. And as that thins, that's when these lumps also start to appear. So it's something long-term that you may look okay right away, but over many, many years, it's going to start to shift, move, form lumps. Your skin and other structures are going to thin. It's going to start to show up more. So then a lot of these patients have to try to cover it up. They're injecting fat over it, fillers over it. They're getting really poofy. It's really a permanent disfigurement. So I don't want people to underestimate how much damage something like that can cause just because there's a party and everybody's doing it. Let's inject a little silicone into our face or lips. Don't do it. Be very careful about that. And then in general, I said one other warning sign is where are you getting injected? Now, it's not always the case, but if you're at a house party or somewhere that's not a medical establishment, may not have sterile technique, may not have FDA-approved injectable material, it may be illegal materials. But I do think there are some cases with very high-end celebrities where they know their doctor, they know he's a licensed physician, they know his background, and they come to their house and inject. It's not as dangerous, but it is very dangerous if you don't know anything about the injector, what they're injecting, and it's not in a medical establishment. Those are all huge red flags that I would tell you, run the other way and do not get anything injected to your face at that house. I think in closing, I would say that in the case of Priscilla Presley, she's a beautiful woman, and in that case, the golden rule is broken in medicine. First rule is do no harm. This harmed her. You know, she had things injected to her face. She may not have been aware of what the long-term complications were going to be, that it was going to permanently be there forever, and eventually form lumps and bumps in her face. So I think it's very brave for her to admit that this happened to her, because hopefully videos like this and other information will get out there to warn people not to inject it into their face. And I think one good thing is hopefully we'll see less and less and less of this, because now there are other things available. So do the hyaluronic acid fillers, do the ones that dissolve, don't put permanent things in your face. So I think all of these things are a move in the right direction. And then if you unfortunately are somebody that had some of this injected into your face, know that it is very difficult to remove, and you have to go to somebody experienced in removing the silicone. You can't really liposuction it out of the face or other areas because, again, it's incorporated and scarred into the tissue. It's very difficult to remove, and only one way to remove it is to surgically excise the actual silicone and scar tissue. And again, in the face, extremely difficult. If it's in your lips, like I said previously, probably possible and a little less scary and dangerous. But again, find somebody who's experienced and knows how to remove the silicone safely and effectively.
This situation may have predated the widespread use of the internet, so who knows how they were finding credibility with these type of treatments. But in today's world, we hear about new devices and treatments all the time. Like, we did a video on I think it's called the HyaPen. It's the hyaluronic acid pen that advertises no needle injections, or no needle filler, excuse me. What's the barometer for determining if something is safe? Like, is it FDA approval or a high-profile plastic surgeon endorsing it, or?
In general, I like to steer away from anything that's new or brand new technology until it's been time tested a little bit. But yes, I would say an experienced, board certified plastic surgeon or any other type dermatologist doctor is not going to want to risk injecting something that's illegal or could harm somebody because it's going to affect their license. And like I said, our first rule is do no harm. So those type of people are not going to be injecting these sort of things into people's faces. It's going to be more these back rooms, hotel rooms, come into houses, things that are, kind of off the radar. And that's where these dangerous things can happen.